Hello, my people. Yeah. So we don't come back again. Now we'll talk about the clinical features. So now, this pneumonia, wetin be the clinical features? So wetin the patient or person wey get this condition go dey present when the person come for medical checkup or maybe when you run into the person. Okay? The first thing wey dey very common wey the person go get na fever. Okay? You understand, say when person get infection, okay, particularly bacterial infection, one of the key things wey person go get na fever. So the temperature of the person go dey high, the person go dey chilly, okay, and the person go feel they shake like this because of there's change in the set point wey lead to fever. Okay, so the next, and how you fit check fever dey very easy, na to use temperature. Okay, na to use the thermometer. Oh, not to use temperature, not to use thermometer. Okay, there are various types of thermometer. Because of COVID-19, we don't get, you don't see this one, they're very common. This one that uses the infrared, and also this one as well, where you go put for armpit. Those thermometers, if you are using that, you can easily, you go get the temperature. Okay, you know, say normal human body temperature, they between 36.6 to 36.7. Okay, when it reaches, for example, 37 still they fairly okay as well, but when it above that, down to 38, 39, all those ones now already you don't pass subfebrile, you don't enter really pyrexia, which is fever. Okay, all right. So now the next thing, next clinical feature where you go see where the where the person go get sorry now cough. Okay, so the next clinical feature where the person go get now cough. The person go dey presented with cough, and we get dry cough. And why it is important, we say if you get dry cough, if you get the wet cough. But for example, dry cough, you go easily know, say in this case, it is caused by viruses, and it is also caused by pneumonia. That one where I call as giroversi. Okay, this and even Klebsiella, these are the ones who produce dry cough. Okay, particularly pneumonia. Okay, and viruses, then will produce dry cough. So when the person they cough, you will see say they dry. You will see say they dry, no fit form. Okay, so cough now another clinical symptom where the person, or feature where the person go get. And the next thing where the person go get now also, you will see dyspnea. That one we would say, oh, the person they find air but you need to see. Okay, so you go force the person go try to get air, but they find air but you need to see. Okay, so you go increase energy to try to get air. So now dyspnea, that they call dyspnea. All right, so that's distortion in breathing, so that they call dyspnea. All right, the next thing, the person, the hyperventilation. Okay, the increased amount of respiratory rate. Okay, the respiratory rate of the person go dey increase. So you go see say the person get cough. Okay, the person get fever, the person get dyspnea. Another thing where the person go get also na sputum production. Okay, sputum na the senior brother of saliva. Okay, so saliva, so they have sputum. So it means say the saliva they very thick. Okay, they very thick. All right, so this one might be sputum production. So there will be sputum production. Okay, so in this case, also that sputum where the person they produce fit also give you clue to which microorganism they cause the pneumonia. Okay, for example, you know, say pyogenic bacteria like Streptococcus pneumonia, Haemophilus influenza. Those Streptococcus, bacteria, they actually produce sputum. Okay, they actually produce purulent sputum. Okay, particularly purulent sputums. So for example, if you see rusty sputum production, rusty sputum means say there's hemolysis. The blood don't they hemolyze, don't cut. Okay, don't destroy the red blood cell. Okay, when the red blood cell don't they crunched and destroyed, you're gonna see say the environment they rusty, reddish. You know, reddish brownish because of say you don't they mix and they oxidized. Okay, so that rusty sputum, you go quickly know say, okay, this rusty sputum are characteristics of particular microorganism where they call Streptococcus pneumonia. Okay, so when you see rusty sputum, streptococcus pneumonia, and when you see streptococcus pneumonia, you're gonna see a community acquired acute pneumonia. Should you see how it is easy, right? So if you're able to get A, if you link A with B, C, D, and then you will get E. You understand? Medicine, they very easy. Now to just get this connecting point. So rusty sputum, you will get that one. Then we get another sputum what they call current jelly sputum. Okay, current jelly sputum. Now this particular current jelly sputum, okay, current jelly sputum. Now when this hemolysis, okay, don't they mixed with the coat of a particular bacteria what they call Klebsiella. Okay, so when this hemolysis don't mix with that mucopolysaccharide where they actually form the coating, the outer cover of the Klebsiella, you will come there get this current jelly kind of appearance. Okay, so once you see current jelly kind of appearance, you're gonna say, oh, okay, this one, particularly this one, they caused by what? Klebsiella species. Okay, and you already know, say Klebsiella species, you go find that one in where? Hospital acquired pneumonia. Should we understand? You see, the hospital acquired pneumonia, gram-negative rods and Enterobacteriaceae will be Klebsiella species. Then when you talk about community acquired typical, atypical pneumonia, you know, say that one now what? Mycoplasma pneumonia, chlamydia species, and which one is the last one? Coxiella bonnetti. Coxiella bonnetti, where they cause Q fever. That one also they part of the microorganisms where they cause atypical. And streptococcus pneumonia, once you see them, now rusty sputum. So once the sputum is rusty, you quickly identify that, yeah, exactly, this is community acquired acute pneumonia. Now, what are some of the symptoms or clinical features that you will see in course of consolidation, when there is consolidation of the lung? So when there's consolidation of the lungs, one of the clinical features where you will see say the patient will get rales and rhonchi. So those sounds where you go to hear when you auscultate. You go to hear breath sounds as well, abnormal breath sounds, bronchial breath sounds. Okay, those breath sounds, they very normal over the trachea. Okay, but once you hear them in any other part of the respiratory system, that's exactly that you can know that there is an abnormality. Okay, bronchial breath sound. There will be increased vocal fremitus. Vocal fremitus, that those one way doctor go to check and then go to tell you to say 99 or 33 or any other very nice phrase. Okay, we go actually cause or trigger vocal fremitus to know whether they increase or they low. But in this case, it will they increase. So the vocal fremitus will be increased. And also there will be dullness on percussion. So when doctor they put hand, they percuss, okay, they check the consistency of the organ. He or she will find out that they consolidated. I remember from beginning of the series we talk about consolidation. Say it means that the lung don't they solidified, right? So therefore, when they percuss, you go they dull. You know, say when you percuss something, we know they strong. We get like air inside. When you go like do boom boom, that one not be dull sound. Okay. So but when you percuss the one where they solid, you go do boom 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 boom. It means say a dull sound. So in that case, that is when you actually you're seeing a patient that already has pneumonia. And that's why from the beginning of this video on this series, you been see say, I tell you say some school of thought, they define pneumonia as an infection where they lead to consolidation of the lung parenchyma or the lungs. So when there is consolidation, there is dull sound, there is increased vocal fremitus, and also the breath sounds are going to be present, particularly in the abnormal areas, not in the trachea, and also you see rales and rhonchi. Okay, so these are the clinical features that you will see or the patient is going to present with, where patient will get in situation when the patient get pneumonia. And from the explanation, you know, say I don't tell them, I say you get even from the sputum, if you know which microbacteria they cause them and which group or which clinical setting this particular form of pneumonia belong to. and also from the cough. I don't tell you for dry cough, pneumocystis pneumonia viruses, where they cause also this pneumonia. You will also know say they in that particular category when you see dry cough. But when you see purulent sputum, rusty sputum, you will not see that on Streptococcus pneumonia. Okay, so up next we will discuss how we fit understand the morphology of this particular condition. So stay put. I'll see you in the next series. All right.